Welcome to this week's edition of 10-Minute Coffee Chats with Tash and Damo.
Sharing our lived experience one story at a time.
This week,
Bariatric surgery is a big decision. We know this. And there is a lot to think about. Before heading into the operating room, whether you've just started your research or you're about to book your procedure, we've got all the essentials.
So let's get right into it. Tash, what do you think the first thing people should know?
I think the pre-op process is really, really important. First and foremost, be prepared for a lot of pre-op work. It isn't something where you just decide today, hey, I'm going to have bariatric metabolic surgery, and then tomorrow you have it. The process usually starts with consultations with your GP first, then you'll be referred on to a surgeon, a dietitian, a psychologist.
Even a psychologist, and that might surprise some people.
Yeah, but you know what? It is such an important part of the process. Bariatric surgery isn't just a physical change. It is a massive mental shift. The psychologist helps us assess our readiness for all of those lifestyle changes as well, and helps us set really realistic expectations. And that is so important.
Yeah, that makes sense. And then there's the whole weight loss goal, I guess, that comes into that.
I mean, yeah, there is, but I think that it's really easy to fall into a whole thing about expectations around that. So it's very important to keep those realistic. Many patients are also asked, or many people are asked beforehand, to lose a bit of weight before surgery. That might seem like a bit of a counterintuitive idea, but actually that is to shrink your liver. A smaller liver gives the surgeon more room for his little instruments or her little instruments. So
they're very skilled the way they do it.
They are. It's quite amazing. We've watched some videos, very yucky, but they're good at it. So
yeah, and that's where the infamous pre-op diet comes in.
Yes.
The shakes.
Yes, pre-op can be really tough. Some people find it a breeze, some people find it tough. I found it tough. Typically, you'll be asked to have VLCD or VLED shakes for 2 to 4 weeks, depending on what your surgeon's guidelines are. They all have different guidelines, so it's important to do what the person that is going to be chopping you open says.
Yes. So setting realistic expectations, and this is such an important one. I didn't have realistic expectations because I didn't even understand that when I had my weight loss surgery. So Tash, let's talk about our mindset and what we need to do and what we need to understand when we're going in.
So I think it's really important that we understand, like from a lived experience perspective, weight loss surgery, metabolic surgery, bariatric surgery, whatever you want to call it, it is not going to fix you. It is a tool, and there is no magic in it. It is just a lot of work to see those realistic but long-term results.
Yeah, because it's not like you just wake up and all your problems are fixed.
Yeah, it's not like, oh.
I mean, I did have someone ask, I thought you were having weight loss surgery, how come you're still fat?
It doesn't work like that. So the surgery helps by physically limiting how much we can eat. If you're having a bypass type of an operation, then it will help with, obviously a malabsorption component as well. But we also have to make some big changes to what we eat, our activity, and just our overall lifestyle if we're wanting to see those long-term results.
Yeah, and I guess it's something that starts pretty quickly after surgery, isn't it? We go on to, or most people go on to a clear liquid diet for maybe the first week, and then nourishing liquids, and that's where you can sort of have things like your drinking yogurt and
all those,
and that sort of stuff.
All those kinds of things.
And I think if you're not ready for that, it can be a bit of a shock.
Yeah, so understanding that pre-operatively, it's usually those VLCD, VLED products for 2 to 4 weeks. And then once you have the surgery, it depends on what your team says. Some teams like people to be on a clear diet for a few days. I was on a clear diet for 5 days, and then I did fluids until day 14, and then I had puree stage for 2 weeks, my least favourite stage, and then soft foods, which was anything I could cut with a fork, and then it was on to normal foods.
Yeah. So, I mean, really, and depending on how our bodies are reacting to it, it could take, quite a few weeks, even
Yeah.
a couple of months to get to where we're eating sort of those normal old
Yeah.
textures that
I
we
mean,
might
again, not everybody finds it difficult. Some people just breeze through, and that's fantastic. It probably did take me about, from when I had my surgery, it took me about 6 weeks to be back onto eating normal textured food. It just took me a little bit longer. And the portion sizes can be quite confronting.
Yeah, I wasn't ready for that. I think the first time I had some mashed potato and I could literally like 1.5 teaspoons.
Yeah. So I would advise you, if you're considering bariatric metabolic surgery, go into your kitchen right now, get 2 teaspoons of something, look at it and think to yourself, okay, well, I'll be eating 2 or 3 teaspoons of food per meal, sort of, in that immediate post-op kind of period. Of course, it increases with time, as it should, and that's completely normal. I've got instructions from my team that say about a cup of food every meal now, and I'm 6.5 years post-op. But some days I still can't eat that much per meal, and it really does vary. But
Yeah,
it's just good to be aware.
yeah. And then we have things like supplements, and sometimes this can be a bit of a lot of varied opinions in that. But one thing that I think pretty much everyone agrees on is that it's going to be necessary for most people to take a multivitamin for the rest of their life.
Yeah, I think that most of the teams agree, most of the research seems to agree that for a lot of people that will be necessary. And you should absolutely do what your own team tells you about all of those kinds of things. For me personally, I would probably have to have a protein supplement for life. That's just the way that my body is with the malabsorption that I have. I'm not saying that everybody needs that, but I'm saying that I need that. And I don't need anybody else telling me that I don't. So
That's
we
right.
should all do exactly what's good for us, what's good for our personal journey and our personal story.
And, because we are all so different, even what your team might recommend in the beginning, it might change during the process as well, because hopefully you've got a team around you that are giving you the best advice for you.
Yeah, that's right. And so, because of the changes in our digestive system, we can absorb things differently. If you've had a gastric bypass or a switch, even more so. So yeah, it's just really important to do what your team tells you, take what your team tells you to take, be diligent about getting your blood tests and things like that, because it's in your own best interest to make sure that you're as healthy as you can possibly be.
Yeah. Now let's talk about exercise, because that's always been such a big thing. Even just the general consensus. We've all heard the eat less, move more. But I think for me with the exercise thing, it's not so much that it helped shift weight, because it really didn't. It was great for my mental health.
Exercise came into my journey from the very beginning. My surgeon asked me to walk every day. He asked me if I would please commit to that, and I have. And I think that it's something that doesn't cost us anything to do. I think that everybody can do that. We can make that little commitment to be out and about and doing that. And if you can do that, awesome. And you know what? If you can't do that, if you can't walk every day, then maybe just make a commitment to yourself that you're going to try to move more.
Yeah, definitely. Now let's talk about the emotional side. Surgery is a big step, and it is really normal to feel nervous, even scared going into it.
Yeah, absolutely. I was terrified,
Yeah.
pissing my
I,
pants.
I was scared I wasn't going to wake up from the
Yeah,
anesthetic.
yeah, me too.
And that is a natural and fairly normal, I think, fear for a lot of people, because this is our first surgery for
Yeah.
a lot of us.
So definitely, this is where the psychological support can be really, really beneficial, and it doesn't necessarily have to cost you a lot. There are ways of accessing mental health supports that aren't going to cost you. You can also obviously ask to be referred to a bariatric psychologist, which is a fantastic option if you're able to do that. We highly recommend it. I highly recommend it. I do that. And I found it to be really helpful for me personally in that whole mindset space.
And how good is it finding people
Yeah.
that have been through the process as well?
100%. 100% reach out to friends and family. If you know somebody that's been through the surgery, support groups online, Bariatric Support Australia. Yeah, there are people that will understand and that do understand what it's like to walk the bariatric journey. And I think that when we do things in isolation, when we isolate ourselves, things can seem really, really overwhelming. It's so important to do life in community.
Yeah.
And I think that there's a lot of strength in that.
And you realise you're not alone.
That's right.
So in wrapping up, we've covered a lot today.
We have. We've
From
talked fast.
Pre-op, mindset, supplements, support, even exercise. There's a lot to consider before bariatric surgery.
Absolutely. But as we all know, it's not easy, but it's life-changing. And if you're considering surgery, make sure you're informed and ready to really commit to the process.
Thanks for tuning in. If you found this episode helpful, don't forget to leave make a comment, even subscribe so that you get
shamelessly
all our videos, and share it with someone who you think might benefit from hearing it.
And as always, take care, stay informed, and we'll catch you next time.
Thanks for tuning in.